almost 60 to 70% of them conceive at the initial level of treatment.
I can say male infertility is equal to female.
This is something message that we need to give to the public. Those kind of things may be there, but they just feel that their body is heated up.
That if temperature outside, would it affect the way embryo forms or the egg and sperm interacts? We don't see a difference.
20% of pregnancies are said to end in miscarriage in a general population.
Summer, summer, summer. Isn't that an exciting time of the year that we all look forward? So many fond memories we've all had. Those delicious mangoes, the tangy pickles that the granny makes, family weddings, journey in the trains with mom and dad, those little fights for the window seat, family festivities, amazing food and loads of memories. I think this has been the memory of summer for most of us. The time's changing, memories are fading away. The climate's changing, global warming is hitting us. Yet another new set of problems. A lot of people now have started to believe that summer isn't the right time to conceive. And if you're undergoing a fertility treatment, more so, not the right time to have these treatments. So, in today's episode of State of the Art session, we have yet another expert of panelists who are going to help us with lots of frequently asked questions if summer is the right time to conceive. Let me have the honor to introduce our first guest speaker for the day, Dr. Krupa Patale. Ma'am, welcome to today's show.
Thank you, Dr. Krishna.
Such an honor. Madam is a senior gynecologist, currently the head of the department, Fernandez Hospitals, a very senior gynecologist and an obstetrician known for her love, passion, and care that she takes care of every patient with a lot of details. It's an honor to have you with us today, ma'am.
Thank you for that lovely introduction.
Thank you. So, joining Dr. Krupa is yet another senior consultant, Dr. Varalakshmi. Dr. Varalakshmi, after being a very senior gynecologist, moved on to the field of infertility, and more than a decade, I'm sure it's more than 15 years that you've been into fertility practice. Do you really enjoy doing this?
Yeah.
You know, the cry of a baby versus creating life. How's this journey been, ma'am?
See, when the patient is already pregnant and they come, they're already in a joy. So they're enjoying. But when they come with infertility, they're not in the joy. They are actually depressed souls, I can say. And when they become pregnant, the amount of joy they show and the gratitude they show and the way they praise the doctors, it's like, done. I'm done.
Amazing. Your expressions speak a lot.
Yeah.
I'm sure you are contented doing this lovely job. So I'll come back to you, Krupa madam. You know, I'm sure as an obstetrician gynecologist, there are so many times the cry of the child is a lovely, happy feeling. But I'm sure you do get to deal with a bit of infertile clientele as well. How has been your experience dealing with the infertile population?
Yes, as Dr. Varalakshmi rightly said, so dealing with infertile couple is entirely different because the anxiety that they come with, that is something that first we need to address. And I think more than everything, as a doctor, I begin with assuring them, yes, it is possible. First thing is giving them that assurance, we are in a situation today that things are possible, not to lose hope. Give them hope is the first thing. We do the initial level of treatments, and when things don't work out, it is then that we actually refer to the fertility doctors. But I can easily say that almost 60 to 70% of them conceive at the initial level of treatment. So what we do is the evaluation. So basically try to evaluate them where things are not working out for them and just help them a little.
Lovely. I think hope. Trying to be positive, lovely two words, which probably make the journey a lot more easier. Joining these two beautiful, gorgeous women. I've got this handsome hunk urologist, Dr. Raghuveer. Welcome on show.
Thank you, sir.
So, from urology to andrology, do you really enjoy this journey?
Seriously. So, as madam said, see, even I want to contribute for the cry of the child. So, initially, infertility is more towards female aspect, but nowadays it's more of male aspect. So, I can say male infertility is equal to female infertility. So, in that way, I was into the field of andrology.
Lovely. So, Dr. Raghuveer initially put on his time into the urology practice and then found a lot of interest in the field of andrology. And for the last 5 years, he's been working as the head of AndroLife, exclusive men's fertility clinic, as a consultant. Welcome on the show.
Thank you,
Looking forward to get more insights.
Thank you.
And finally, but last but not the least, I've got a very special guest. And let me introduce him as the cool guy, and I'll tell you why it is. Welcome on show, Mr. Sumit Mantri. Mr. Sumit Mantri currently is the head of the logistics chain. He deals with the hormones, and that's why I call him the cool guy. This whole treatment of fertility involves a lot of these hormonal injections. From the time they're produced in the factory till it reaches the customer, I think a lot of care in terms of temperature control is absolutely important, and that is why Sumit is an absolute important part of today's podcast. Welcome on this show. Sunil right now is heading just not India but a lot of neighboring countries as the head of the logistics from Organon company. Welcome to the show, Mr. Sumit Mantri.
Thanks. Nice introduction. Thank you.
Lovely. I think we'll get more details on this program for you. So let's get started. Summer and pregnancy. I'm sure you have so many questions, and here we go with my expert panel today, who is going to throw more light, more insights, and let's see if summer is not a great idea for pregnancy. So, madam, I think before we really embark onto this whole episode of pregnancy, let's take a step back. We all know we need to have a normal, regular menstrual cycle. So do you really think there's a variation in the days of the menstrual cycle just because it's summer?
Yeah. So research has shown that the cycles do get a little shorter, because of the extreme temperatures, and the ovulation also happens 2 to 3 days before. And a little bit of menstrual irregularities can happen, like, shorter cycles but prolonged bleeding. And all this is attributed to a little bit of change in the hormonal levels that happen in the body because of the extreme heat. So, but having said this, I have not seen in my practice that women, don't get pregnant in summer. They do ovulate. And in fact, it is said some of the studies have shown that the fertility rate actually increases in summer. It is attributed to various factors, like probably many of them, consider summer as a free time, summer breaks, vacation time.
Personal time.
So, yeah, it's a personal time. So, though there are a little bit of changes in the menstrual pattern, it doesn't, in a major way affect the fertility aspect of it.
Lovely. So, Dr. Varalakshmi, I'll come across you there. Now that we were talking about this whole menstrual cycle, the duration, as a fertility consultant, how important is it for a layman to understand and get alarmed? Can, delayed periods or shorter periods or any concern, irregularity with a period alarm a patient, and you really would want to give your insights where they should come and see a fertility consultant?
See, frankly speaking, the variation in the cycle length is important to understand, because the ovulation depends on the cycle length. So, if it is shorter, the ovulation happens earlier. If it is longer, it may get delayed. So, my advice to all the couple who are trying in summer would be, instead of going with the apps, calendars, checking for the ovulation days, because we do not know the duration in summer. So, we can go with the intercourse alternate day from the time they stop the bleeding till the next period, so that they'll not miss the ovulation.
Oh, that's a lovely insight. I'm sure we all with all the apps and reminders we have, we've kind of made this
Yeah.
concept of pregnancy app-based. But I really love that suggestion of being sexually active every alternate day and not depend on an app. So, Dr. Raghuveer, your insights in there, this whole concept, a partner trying to tell you that, you know what, I'm in the ovulation period and we really have to be sexually active. Does this really put a lot of pressure on the man?
So not actually. So once the period starts, once the period gets completed, as madam said, so they have to frequently start trying it, and particularly during the ovulation period may get tensed, but it usually does not impact the men's health.
Lovely. So, since you took that question as well, we don't really see that trying to put a pressure about, this is the D-Day where people are probably handling it well, but still an alternate day intercourse should be a great idea. But again, coming back to the concept of today's summer. So with the man in particular, do you really think anything that is not going well in the body where we should be concerned with the act of pregnancy?
So one thing, the testis temperature is usually 2 to 4 degrees lesser than the body's temperature. So you should not increase the testicular temperature. So as you know, summers are prone to increase the body temperature. So by maintaining the adequate measures, you can maintain the testicular temperature, which should not impact the sperm production.
All right, lovely. Straight question to you. As a customer, as a hospital, when I receive the pack of medicine, gonadotropin, hormone to us, how do we know that the temperature logistics from the factory to the hospital was all streamlined?
Yeah. So basically, as I told you, there are 4 stages, and there is a stability studies done for the temperature sustainability of that particular product. So that stability studies gives some data that this product is stable for so many hours. And what supply chain does is they distribute that overall number of hours in all 4 stages. So sufficiently for each of the lane, they provide the sufficient hours that even if some small excursion, even temperature excursion happens, the product stability is protected. So,
great insights from you, because for a long time we all have thought that summer, I don't know, you'll have to add Dr. Krupa and Dr. Varlakshmi, that during summers the efficacy of gonadotropin injections comes down, or the quality of these hormones are not great. Did we all think like that, and is that the truth, or we've not really thought it?
No, Krishna, never we had that concern. So when we are all doing the cases.
Oh, lovely. That's a lovely endorsement to Morgan on from Dr. Varlakshmi.
Yeah, so.
Great. So Dr. Raghuveer, from the hormonal injection, back to you again. A very basic question, now that, the days are longer, the heat's more. Does a man have a low sexual drive or a low libido just because it's summer?
No, not actually.
Or is it more?
So in fact, in summers, so they get more time to spend in the home. So they get more holidays. So the stress may come down. So all these factors may increase the sexual drive, and they get some time for frequent intercourse.
Love. So summer's not a bad idea at all. I'll go back to Dr. Krupa there for the next question. What has been your general perception? It's holiday time for everybody, but March, April, May, these 3 months, do you have a lot of clients coming for registering for antenatal checkups because they're pregnant? Do you really see an increase in your business?
No, I don't think so.
It doesn't really matter whether it's December or
yes.
April. I think your OP has been the same.
Yeah, OP has been the same. But my question to the fertility doctors is, even now, women have a concept, thing in their concept is that they should not try IVF and fertility treatments in summer. Probably some of the fertility centers are still doing that. So just to, put more light on this, is this true? Do the fertility doctors say, okay, let's not do any fertility treatment, especially IVF treatments, in the extreme summer months? So that's a question that is asked by my patients to me. Shall we stop for these 2 months and resume maybe later?
So, to say, it is actually good. There is nothing like summer. So already it is proved that summers are good for conception, and same with the IVF treatment also. So as he has already told you how the injections are maintained, so there is no temperature variation, so there is no efficacy which is going down. That is the first thing for any patient when we are doing an IVF. We think about the injections first. Next, coming to the patient whoever is taking the injections, nowadays the standard of life has increased. They are all comfortable, and if we take a little precautions like hydrating themselves, wearing cotton cloths wherein there is not much heat produced, and all these precautions if you can take, then I think it is not a concern
So
at all.
do you also give these specific insights or little suggestions to patients to add on something, especially for the summer months? Any special advice? Just
Yeah, it is mainly hydration. Yeah, to keep themselves hydrated, which is extremely important, and avoid extreme exposure to this thing, to the heat. And otherwise, I think it is the regular, regular practices and all.
lovely. But your question was what we want to stop fertility treatments, but I'll come back to you with the fact that just because of heat, any specific gynecological condition that you think would flare up, like I don't know, it would endometriosis flare up just because of a seasonal change?
Yeah, so actually there is no direct effect of heat on endometriosis. It is just a woman's perception. See, usually extreme heat, the stress levels increase, or again dehydration and these kind of things. Her pain and her irritability, symptoms like burning micturition, these kind of things, UTIs are common. Because when they don't have sufficient water, these kind of things are common, and everything is attributed to the endometriosis that she already has. So otherwise, I don't think there is any direct relationship.
So none of the gynecological symptoms or whatever diagnosis would flare up just because of heat?
No.
Lovely. So Dr. Raghuveer, we want the male perspective out there. As ma'am said, hydration is important. We don't want ourselves to expose to extreme heat and all. But we understand. I'm not saying women don't get on roads in hot sun, but we see most of the men on the roads, especially all the delivery executives. My heart goes for them. In this hot summers, I'm happily sitting and swigging and blinking it. And they're all out there on the roads. Do you really think this is going to bring their sperm counts low or affect the testicular function?
So again, if they maintain the proper measures, I don't think it's going to affect it.
What are those proper measures?
So as madam said, adequate hydration. So stay indoors and wear loose clothes. And in fact, we can say take some antioxidants and few supplements like zinc, vitamin E. So all these measures will...
Wearing tight clothes, that's kind of going in my head there. So what do you think? Boxers or a normal underwear? Let me go with a rapid fire.
Boxers.
Boxers. Jeans or normal pants?
Normal pants.
To wear or not to wear? Lovely. So I think, boxers, and I think, it's lovely that Dr. Raghuveer, Dr. Varalakshmi and everybody has put in. So let's just quick summarize what we've discussed so far. I think with the temperature of summer going up, neither the female reproductive function nor the male reproductive function in terms of the ovaries function, ovulation or the menstrual cycle or the hormones. Similarly on the man, just because the heat's gone up, neither the testicular function nor the sperm production seems to be getting altered, and the pharma companies are bringing in state-of-art technologies to ensure this whole shipment of medicines and hormones are not affected, and the efficacy is as good as any other month, probably January or December or June. All right, now let's get more deeper into this discussion, ma'am. I think the question is very specific. A lot of people think that if they're undergoing any fertility treatments, okay, here's the March and April months, let's stop it. And well, you did tell us that the physiology is not changing much. But what are the common questions that you encounter from the patients who come to you in a fertility OBD?
So, Krishna, usually they ask me saying that I'm taking these injections. Do my body produce more heat? Which again is a myth. There is no such thing called body heat. If you're taking a normal balanced diet and you're taking care of your hydration, there is nothing called like heat. As already ma'am has told us,
Yes.
that in summers they don't hydrate and there is a burning maturation, which is because of concentrated urine, not because of that heat in the body. So they take it as a myth saying that I'm having heat in the body. It's
So
not.
there's no concept of heat.
Yeah, this
You
is
agree with
something,
that?
yes, I totally agree with this, and this is something, this is a message that we need to give to the public, because this concept is so strong in the families that yes, my body is heated up. They just come to the clinic saying ki give something for the heat to, reduces. What is it? What are your symptoms? They are not able to explain their symptoms. But generally, yes, like burning, micturition, those kind of things may be there, but they just feel that their body is heated up.
But one question, I'll interrupt you there. I again read this somewhere that normally also when ovulation happens, the basal body temperature goes up.
Yes.
Is this a truth?
And that is scientifically, that is correct at the time of ovulation. But that doesn't make a woman feel as if she's being, overheated or something like that.
Lovely. Dr. Varalakshmi again.
Yeah, and one more thing I want to add here is the food what we are taking. If we are taking too much of spices and we are not hydrating ourselves, that leads to constipation. That also they think it is the body heat that is making.
సో అంతా పచ్చళ్ళ సీజన్ బాగా పచ్చడి తినడం, నీళ్ళు తాగకపోవడం.
Yes, correct.
మజ్జిగ తాగాలి, నీళ్ళు తాగాలి, హైడ్రేట్ అవ్వాలి.
So lot of liquid diet should be added in.
I think it is the gastritis kind of a feeling, and constipation and burning micturition. I think these three things are attributed to excess heat in the body. So we need to specifically ask them, what exactly are you feeling? So then they may come out. Sometimes they'll not have anything, just feel it's. See, I'm very warm. Sometimes literally they ask us to touch them. I said, no, you're not warm. You're fine.
So is there a fertility specific diet for summer? Is something that you want to tell our viewers about it?
Not particularly any diet is there. Just hydrate, as we are all discussing since long time. Take lot of liquid diets. Avoid spicy foods.
So mango is okay?
Yes.
Because that's the beginning of the season.
No, you have.
Why should we deprive them of, having that seasonal fruit?
Yeah, seasonal
Yeah.
fruit.
Like, so as long as you're having plenty of water and buttermilk, hydrating yourself, this should all be okay.
And he has told the attire what we need to wear.
So do men also have come and talk to you about anything about summer,
Yeah.
things changing in their
సేమ్
body?
థింగ్. సో బాడీలో హీట్ ఉంది, నాకు చాలా వేడిగా ఉంది, సో నా టెస్టిక్యులర్ టెంపరేచర్ ఎక్కువగా ఉంది. సో దే సే ఆల్ దీస్ థింగ్స్ అండ్ ఐ విల్ ఎక్స్ప్లెయిన్ ద సేమ్ థింగ్. సో ఇట్ ఆల్ డిపెండ్స్ ఆన్ ద డైట్ యూ టేక్, ఇట్ ఆల్ డిపెండ్స్ ఆన్ హౌ హైడ్రేటెడ్ యూ ఆర్. సో అవాయిడ్ స్పైసీ ఫుడ్, అవాయిడ్ జంక్ ఫుడ్, take more of fruits, vegetables, salads, dry fruits, sprouts. So all these things will
Basically, lot of fiber.
lot of fiber food.
But anything in summer specifically, if we have to advise about smoking or alcohol, any specific limitation just because it's summer?
Obviously. So again, summers are more prone for smoking and drinking. So
Because socializing,
exactly,
lot of parties
exactly,
going on.
lot of parties and all. So cut down your
Intake of
Intake of
smoking and
smoking and
alcohol. Hydrate yourself. All right, lovely. That was a lovely input. Madam will again come back. Let's get more deeper. Now somebody is needing an IVF treatment. When you give them the injections and treatment, do they really come back with a lot of side effects and complaints just because it's summer compared to what it was in the earlier months?
Not much. Only as we are thinking, if they are in a cool place, so we are giving injections. Maybe that injection spot, if it is sweaty, maybe that will give little itch, and these are all temporary symptoms. So if you can keep if you are in a cool place, avoiding sweating and hydrating, I think there are no side effects. Even if there may be little of water retention, not more than that. And when we are talking about these summers and the treatment success rates, I don't see there is any difference, because we have the evidence saying that there is no change in the conception rates. Either maybe it is natural conception or IUI or IVF. Season will not affect
Okay,
it.
season, there are no major symptoms. So from the therapy, we go back to the factory. So, Sumit, do you really see a dipping in your sales demand and supply when we're looking at especially these 3 months in India?
Yeah, in India, definitely yes. We see dipping in the sales.
So, which means people are probably not looking forward to do treatments.
I think so.
So, any region specific, this is happening more towards the north or south or east or west. Have you seen some kind of a difference in your logistics?
specifically in South.
So there's a lot of myth that is going in the south, so we got to work more a bit there.
Absolutely.
But okay, this is India, and we do see some dipping. But trust me, India is not the only country where summer is so hot. There's a lot of neighboring countries, and luckily we have you taking care of the logistics in the neighboring countries as well. Have you seen this trend in any other country?
No, actually no. So these trends are specific to India. Rather, not only neighboring countries, but I would also talk about Middle East. I would talk about Australia, Russia. I have gone through the data, demand data. We never seen any kind of fluctuation or seasonality for fertility products or hormonal products. We never seen any such kind of seasonality. Only season when demand drops, specifically in Australia or anywhere, is due to the people go on vacations. That's the only time when
The holiday times is where it's coming.
nothing per se for the climatic condition or maybe temperatures.
All right, lovely. So again, from there we come back to the treatments, madam. Anything like, would the dosage of the injection should be increased in summer? Have you seen a trend towards that?
No, never. So, because of season, change in the dosage, change in the response of the injections by the ovary, there is no
The
change.
ovarian response remains the same, and your outcome also remains.
It's the same. So now I would like to ask you a question, saying that, see, we are talking about injections, we are talking about the patient compatibility with the injections in the summer. What happens in the lab?
So now let's talk more about the laboratory aspects in these fertility treatments. We realize that, the body is not getting affected. Ovary, egg, sperm and testis remain to be unchanged. And now that you're undergoing IVF treatment, when you stimulate the lady, no major side effects. So now, as an embryologist, when we get the egg and sperms in the lab, there's always this curious question that patients ask, that, is there a change in the quality just because of summer, the fertilization comes down or the embryo development comes down? I think we don't really get to see any of these trends. There's a lot of research, a lot of studies done specifically in this aspect, that if temperature outside, would it affect the way embryo forms or the egg and sperm interacts? We don't see a difference. And more so in countries like Africa, where throughout the year it's hot, or cold countries like Canada, Russia, where most of the months of the year is cold, I don't really see there is any change. I think there's something called as body's homeostasis, and bodies knows how to adopt and adjust. So madam, to that question, would we as embryologists see any kind of a change or a difference even in the quality of the egg or sperm, or the way they fertilize or they grow? We don't see a major difference out there. So now, as an embryologist, when I'm giving you very good embryos in summer, the question to you is, any issues with the thickening, the endometrium of the uterus? Any problem with that growing in summer months? The vascularity or anything?
Yeah, so there is not much change, because these are all modified and artificially we are treating them and making the endometrium grow. So there should not be much problem. So we can titrate the doses, but season will not affect. Definitely, we titrate the doses based on the patient's response, and then we check the hormones. If everything is fine, then only we do. But I don't agree that summers will cause a thin endometrium. That is what I.
So, do you agree with that, ma'am?
Yeah.
I've never seen thin endometriums in
No,
some.
I don't think so. I mean, not a major difference between, winters or summers. Matlab, seasonal variation we haven't come across.
And even the window of implantation, that doesn't change with the season. Definitely with the type of cycles what we are doing, there might be a little alteration, but not the season.
Okay. Now that the lady is pregnant, we go to the next thing, which is the first 3 months, which is very important. Do we get to see, because that's the next myth. People think that, there's a lot of miscarriage that might happen just because of the summer and heat. Do you really come across any such?
You're talking about natural pregnancy or
First,
IVF?
let's talk about natural pregnancy. Any higher incidence of miscarriages?
See, in general, 20% of pregnancies are said to end in miscarriage in a general population without any risk factors.
So, of every 10 women who
Yes,
conceive,
yes, 20%
1 or 2 will miscarry.
with miscarriage. So that is a nature's way of, getting rid of embryos which are not healthy, which may not grow into a normal fetus. That's what is the explanation given. Unless it's a recurrent, we don't go into the depth of it.
Okay.
So having said that, will summers or extreme heat cause miscarriage? There are a few studies which have shown a slight increase, but it is very difficult to prove that yes, this miscarriage was due to that extreme heat. So in general, if I have to say, I don't think there's a major difference in the miscarriage rate in summer.
Lovely. So, what do you think in IVF it's happening, madam? Do we really get to see this kind of a trend?
No, not really. As madam has explained, there is not much increased risk of miscarriage in summers.
But in general, as ma'am was saying, a natural pregnancy, there's a 20% chance of an inevitable miscarriage trend that we get to see. What is the general percentage of miscarriage in an IVF cycle?
So here also it doesn't differ. It is the same. So any woman who is pregnant, either naturally or with IVF or with any sorts of treatment, the same percentage remains for the first time. But if it is repeated, then we are worried. And in IVF, we take care of that also to check, because most of the miscarriages are because of the genetics of the baby. So in IVF, if it is getting repeatedly, she is having miscarriages, we check the genetic testing of the embryo. That is called PGTA, and then we do the normal embryo, euploid embryo transfer. That will at least take care of 40% of the miscarriages which are happening because of the genetics in the woman, baby genetics.
So, we'll again move to you, sir. There again, I don't know if this is a myth or a fact. Very hotter countries, Middle East and Africa, would these temperatures make these men azoospermic? Is the incidence of azoospermia very high in hotter countries?
No, sir, not actually. So, azoospermia, it's nowhere related to temperature or a particular region. So, it depends on, again, as madam said, few genetic issues, few lifestyle issues. So, it's more of lifestyle and a genetic issue, and sometimes varicoses, all these add for azoospermia. It's not actually related to climate or
so
region.
Azoospermia in summer has got no correlation. Sperm count has got no correlation.
No.
But what would be your few little take-home points for all our viewers when it's about male infertility and summer?
So that's what. So take adequate measures. As we are discussing, it's about hydration, clothing. So, and in fact, you decrease the exercise during summers. It should be moderate. So take proper supplements and proper diet. So all these things will not affect your sperm count.
So summer is enjoyable gala time and nothing should stop.
Definitely.
That's a great message from you. Dr. Varalakshmi, as a fertility consultant.
So in fact, I think, I don't know he'll agree or not, laptops in the lap and the cell phones in the pockets are more harmful than summer.
Lovely. I agree. Sure. No laptops in the lab. Now that's a very scary thought, but if that's a threat, I think let's relook at that. Dr. Varalakshmi, closing remarks from your end. As a fertility consultant, summer being around, please do tell us few little concluding remarks and the best practices.
See, anyone should not be worried based on the season whether we need to go for the treatment or not. Don't waste your precious time thinking that seasons will affect your fertility, your embryo quality, or implantations, or they're increasing your miscarriages. It's all a myth. There is nothing called like body heat at all. It is all your lifestyle which is making your body get some side effects because of lack of hydration, lack of fiber in your diet, and these things. Other than that, there is nothing like heat, and nothing like anything is stopping a woman from becoming pregnant in any season.
సో శుభముహూర్తాలు, విందు భోజనాలు, సో వేసవి కాలంలో ప్రెగ్నెన్సీ కూడా మంచిదే.
Yes.
చాలా సంతోషం. మేడం, let's have the closing remarks from you as an obstetrician and gynecologist. What is your advice for all those women who want to build families in summer?
So definitely keep trying, even in summer. Don't stop. And when they become pregnant, they need to take care of themselves. That is important. Yeah, so some very basic things like early pregnancies, hydrate yourself. Extreme exposure to heat has been shown to increase the risk. It is said that the blood volume suddenly can, decrease, and whatever it is, a placental supply can decrease. These are some of the theories that have been put forth, but a woman has to take care. If she's taking proper care, like hydrating herself well and avoiding exposure to extreme heats, eating right food, and keeping herself comfortable, I don't think there's any concern with her pregnancy.
That was very reassuring, madam. I think,
One question, ma'am.
Yeah.
What about the patients who are having hyperemesis in summer
Yes,
months?
they should be even more careful because hyperemesis obviously can give rise to, dehydration and its complications. So I think these are the women, we need to support them well, probably with IV fluids, parental fluids when they are not able to tolerate oral. So we need to be careful about these things. And other thing is to avoid infections like UTIs are very common in summers. So which in pregnancy, we totally want to avoid these kind of infections, so that they have to be careful about. Take appropriate treatment, appropriate investigations, and they'll be fine.
So just with few little things like hydration and few changes in lifestyle, summer is not something that we got to be worried
Absolutely no.
about.
Yeah.
So Sumit, your closing remarks. Thank you so much. I think, the cool guy again out there, in the summer months, I think logistically great job out there. Without having a good hormonal injection where the patients are putting in so much of financial resources, there's a lot of pressure to deliver, and such a lovely job, such a lovely support from Organon to help us take on this in the right way. Any closing remarks from your side?
Surely, I would advise everyone, whoever is watching this podcast, maybe all the patients, and also you all doctors, sir, madams, that you should not be worried about the product's efficacy or the quality, because we are there to take care of it. The whole supply chain is perfectly aligned to maintain temperature, to maintain quality throughout its journey until it reaches to you. So
what a lovely discussion. Thank you, experts, for all that insights and the lovely time that we've spent. So ladies and gentlemen, summer is around and nothing that we need to be worried about. We just need to hydrate ourselves. It's time for vacation, but I don't think until we hit this dream of parenthood and childbearing, I don't really think there's a need to pause or break. Body's physiology keeps kicking in, and there is a lot of research which says summer season is the most fertile time of the year. So in this whole episode of family building, parenthood, it's such a lovely thing that as a team, we have the obstetricians and gynecologists, the fertility specialists, the industry people, and the andrologist coming together, holding hands together, and trying to bring across this awareness that summer is not a difficult month. It isn't a time to stop trying and planning for pregnancy. Let this legacy of parenthood, family building, and childbearing continue. Thank you so much.